Hawaii is known to be a melting pot of cultures stemming from the plantation days. In recent years, thousands of people from Micronesia have migrated to Hawaii under the Compact of Free Association with the United States. Many in the Micronesian community say they've moved to our islands for better opportunities, but instead they are faced with bias and discrimination. So what can be done to resolve the ethnic tension? Tonight's live broadcast and live stream of insights on PBS Hawaii start now.
Aloha and welcome to Insights on PBS Hawaii. I'm Laura Yamada. Well, Micronesians are one of the fastest growing groups of people settling in Hawaii. They're often lumped as one, but the region is comprised of thousands of small islands in the western Pacific Ocean. It's estimated that 15,000 to 17,000 Micronesians are living across Hawaii. They've come here through the Compact of Free Association, or COFA. The agreement allows citizens from the federal states of Micronesia, the Republic of the Marshall Islands, and the Republic of Palau to live and work freely in the United States in exchange for U.S. military control of strategic lands and waters in the region. While Micronesians comprise only 1% of the state's total population, many have encountered bias, discrimination, and a general lack of respect. Our panel tonight will discuss how we can change the stereotype. We look forward to your participation in tonight's show. You can email, call, or tweet your questions, and you'll find a live stream of this program at pbshawaii.org and the PBS Hawaii Facebook page. All right, now to our guests. Shanti Sigra Asher is the Pacific Islander Liaison Officer at the Office of Economic Revitalization for the City and County of Honolulu. She earned a Master of Science degree from Chaminade University and a law degree in San Diego. She currently sits on the Hawaii Board of Education. Filios Uruman is from Fananu Island in Chuuk. At age 11, he and his family settled in Waianae. He is a project manager and professional interpreter of the Chuukese language with Language Services Hawaii. He is also the co-founder of NoNo, a private virtual organization to help migrants transition when they move abroad. And Dr. Wilfred Alikin is a family medicine physician who serves as clinic chief for the Kaiser Permanente Medical Center in Hilo. Born and raised in the Marshall Islands, he attended college on the mainland and earned his medical degree from the John A. Burns School of Medicine at UH Manoa. Thank you so much, all of you, for joining us tonight on a complicated but very important topic for us to all talk about. And so I think maybe first, Dr. Alikin, maybe I'll start with you. I want to set the stage just a little bit, give people a little bit of context as to where we are today and sort of what happened. Many people might not be as familiar with the history between Micronesia and the United States. I believe about 1946 to 1958, the U.S. had been conducting nuclear weapons tests, various locations, Marshall Islands, Bikini Atoll, and the COFA agreement is basically a compensation for the fallout from these nuclear tests. Can you expand on that a little bit more and sort of why the U.S. was doing nuclear tests at that time?
Thank you. Thank you for having me. First of all, thank you for the invite and for this forum to really address this issue that's really affecting the Micronesian community. Yeah, I think it's a good place to start. Before the compact of the free associations, these Micronesian islands had decades of relationship with the United States. After the World War II, I believe in 1945, the United States assumed administrative oversight of these islands under the UN Trusteeship Agreement at the time. And the main objective, as I believe, was to make these islands more economically reliant. At the same time, in the midst of the Cold War, they started conducting nuclear weapon testing on the island of Bikini in the Marshall Islands. There were about 86, I believe, testing that were conducted,
wow,
including the most, it's the hydrogen bomb, first ever detonated by mankind. It was the highest, strongest ever. In fact, it's equivalent to 1,000 Hiroshima bombs. That was the strength of the test. Now, as a result of the testing, the people of Bikini Islands, have actually moved from the island. and this island is no longer habited. These guys are, you can say, nomads in their own islands. Now, not only Bikini Islands, but there were several other islands that were impacted by the fallout. And we believe this damage went beyond the Marshall Islands, maybe all the way to the rest of Micronesian Guam. You know, the strength of the testing. Now, right after the end of the administration of the United States under the TT-ship Treasury Agreement, these islands were given political status. So they had a referendum. At one point, there was one Micronesia, including Marianas. So in their the choice, they all split up into 4 entities. The Marianas became the Commonwealth of the Marianas. Palauans became the Republic of Palau. The Marshall Islands became the Republic of the Marshall Islands, and the rest was the Federal States of Micronesia. Now, the compact really is a treaty between these different entities with the United States, and it's very simple. It's these islands are given to the United States, so they hold the strategic veto power, meaning no other nations can enter these islands or form any kind of military relationships without the United States consent. In exchange for the island peoples to be able to migrate to the United States without visa to live and work. So really it's a quid pro quo, you know, nothing lopsided. So it's not really compensations. It's you know, it's a treaty between these 2 islands. So in addition to, in exchange for these islands given to the United States, they give this economic package along with these rights to migrate to the United States. So I think it's important to really understand these the relationship, because it's the mutual benefits to both sovereign nations, and that's the reason why a lot of these people are here. You know, they're coming here for medical reasons, for seeking better health, economic opportunities, and it can be for other people, if they don't really understand the culture, then the history, I can see why there could be these patriotic narrative and rhetorics.
And I definitely want to get into some of these different areas that I think are really important for people to understand just how incredibly traumatizing this has been for many years and recent years. And you know, maybe Shanti, I think I read you know, some of the articles that you put out about your experience, explaining what you went through, and giving people a sense, all of you really, but giving people a sense of what it was like and what it's been like and what it continues to be like for people coming here and displaced in that way. Can you talk a little bit about your experience and what you recall that was like trying to make that transition and then coming here and dealing with, you know, all the challenges here in the islands or elsewhere in the United States?
Yeah, thank you very much. I'm going to respond, but can I please, I want to echo Dr. Alikin, thanking all of you for making this platform possible and for the invitation. And for all the viewers, thank you so much for following us, because this is, like Laura said earlier, is a very, very important issue for many of us, especially our children. And for myself, I want to say that unlike many of our kids who call Hawaii their home, for many of them, they were born and raised here. So this is their home. For me, I was one of the fortunate ones, I will say, especially in looking at the experiences that our fellow Pacific Islanders, especially Micronesians, are going through, because I came here grounded. I am proud to be Micronesian because I was born and I was grown into the values and principles that we know defines us. So when I came here way back in 1999, I can say that I was one of the fortunate ones, because because there were few Micronesians here, we were able to enjoy being Micronesian because no one really knows about this population. So we enjoyed just going out to the beach, going to the airport. There is nothing negative about being Micronesian back then. And then fast forward to 2010. That's when there was an uprise in discrimination. We started making it to the front page of the Honolulu Advertiser, the Star Advertiser, because of negative coverage. And I remember I was doing my master's at that time, and I wanted to, because of that, that kind of triggered my interest and curiosity. Why? Why is it all of a sudden we started making it to the front page? And I know that we're good people at that time, but why? So I called the police station, the headquarters, and spoke to one of the chiefs to see if I can do my paper on violence. And he said, it's actually, if you want to do more research and data statistics on this issue, then you're not really going to get good data because we don't really have enough, and you're still lumped under Pacific Islanders, so it's going to be very tough for you to have data. So from there on, I started wondering about this increase in negative, this hate. It started going on the stations. I started not wanting to turn on the radio in the morning because they started making all these jokes that are very offensive. And then I thought that was bad. Fast forward to today, over a decade from today, from 2010 to now, I did not, to be honest, all that was going on, it did not get easier. It got worse. We actually left in 2010 back to Micronesia because I did not want to raise my kids in this climate. One thing I want for them to have is pride of who they are. And they're probably not going to get that if they were growing, if they continue to live in this climate.
Shanti, do you feel like, as many more years have gone by, do you feel like now you've better identified why around, you identified a point in time or a period of time around 2010 where you felt like there was something of an uprising of negativity toward, Micronesians? And do you feel like you understand now, or is it still a bit of a mystery to you? What was happening at the time?
There are many factors that are causing this, and many people have covered it in different talks. And one thing that, one answer that many people say is, oh, every ethnicity, every race that comes here go through that. But you know what's different and unique about our group? There is social media. And with one click, one update on a status, it goes viral. And so that's one thing that I felt just exacerbated all the negativity that used to be just covered on a newspaper. Today, it's easy to just send it out, and with people that don't really need that justification, it's easier to recruit. I'm just gonna say that it's easier to. So besides the numbers, the influx of migration, coupled with social media and how easy it is to get out information, especially negative information about this population, it is very disturbing.
So I definitely want to get to more of that as far as what's been happening, why, how to possibly dispel that. But Philios, I want to get to you because this is something that that you've been through to make the transition here, and your family as well, and you've done an awful lot to help your family and your community. But talk to us a little bit about what your experience has been making that transition over the years, and then also trying to do that for your family and for your community.
Thank you very much. Well, along with Shanti and Dr. Ali, I also wanted to thank you and everyone else who is part of this panel. I moved to Hawaii when I was 11 years old, and it was during the time where many Micronesians started to migrate from home to Hawaii. And a very large number of Micronesians moved out here. And after moving to Hawaii, I had to learn the language. Today I'm very fluent, but I had to learn it at age 11. So then as a young Micronesian, I get to learn the language quite easier than the older folks. So while living here, I had to act as the interpreter for my families, for my mom, for my aunties, cousins, uncle, when applying for social services, for jobs, and when they go to their doctor appointments. I remember one time I had to skip school because my cousin who was taking her son, my nephew, to the hospital, um, was afraid to go by herself because she does not understand what is being said to her, and she doesn't know how to speak for herself or ask questions. It's harder for her to speak the language. So I had to skip school and went with her to her appointment.
What do you, Filios, I want to stick with you. What do you want to explain to people about, the difficulties in trying to, assimilate and to, find a place here to be comfortable and to find success, whether it be through job or through work or finances? I think there are a lot of stereotypes that, I don't know what sticks out to you the most, but what would you want to address, and how would you want to respond to some of those stereotypes?
I think it's good when people knows the system here and also knows how things work in the Western world, like in Hawaii. One, people should know that it's a mandate law that every agencies who got fundings from the federal government or from the state government have to provide an interpreter. So as an immigrant to Hawaii, you have the right to request for an interpreter. If you go to the hospital, ask for an interpreter. If you go to court, it's a very hard language in itself. Someone who speaks English is still lost in the language in court. So ask for an interpreter.
So this really is a question for all of you, and maybe Dr. Alikin, I definitely want to get back to you and talk about some of the COFA agreement, how that breaks down, and what people need to understand. But Shanti, maybe let me just get back to you really quickly about these stereotypes and what stands out to you as well, and what's your response? What do you feel that either people need to understand or just be aware of with some of these stereotypes that seem to be lingering and being spread more through, as you mentioned, social media and other entities?
That there are more people from Micronesia that are doing great work. Definitely behind the scenes. And one thing I just want people to know is that a lot of our children are getting bullied in school, and they just want to have that sense of belonging. And that's why my being a board member of a Hawaii State Board of Education member is very important for me as a Micronesian, because that creates that bridge. Hopefully there is more cooperation and partnership as we move forward, because one thing I want to share, Laura, is that Hawaii is very special to me and many Micronesians, because this is the place that we were able to attain education to get where we're at today. Without the compact agreement and the benefits that it offered, I would not have been had that opportunity to come to Hawaii to further my education. So it's very dear to all of us. And we are here because we want to build relationship and we want to fix whatever are the problems. If there are misunderstandings, we want to address or answer some of the questions because it has to start happening so that our kids can have equity and access to brighter future just like everyone else. And so we're here really to share our experience and also our gratitude. We understand there are challenges, but we are here grateful and we want to get better in building those relationships and the misunderstanding.
And Shanti, what do you feel like are the biggest stereotypes and biggest, most damaging misconceptions that need to be addressed or debunked?
That we do not value education, that our parents do not value education because there is chronic absenteeism. I'm going to focus more on school because that is really the key to capacity building and development, and maybe providing the access for our kids to the ones that have been dropped out and are lost in whatever ventures they're going through. It's really having those misconceptions that we don't value education. When our kids do not show up to school, it does not mean that the parents don't value education. Many times it's because many of them can't afford a babysitter. So we gain responsibilities at an earlier age. Some of them may feel intimidated to go back to a school that may have said something to them that was hurtful. So really, the goals are, I know that with DOE's hopes of providing equity and excellence to all, that is where we have to build. The first one is really to provide a welcoming environment for not just our students, but for our parents.
And Dr. Ali, you're as a family medicine doctor, you see these entire families coming in. You hear their stories. You deal with their struggles, of course, medically, but also within the family unit. What are you seeing that really stands out to you? And we'll get to the medical aspect more in just a little bit. But as you work and treat and build relationships with these families that come in to see you, what are you seeing? What really stands out as far as misconceptions that are damaging and most difficult for them to overcome?
Yes, I think one of the biggest cultural misconceptions, like they don't show up for their appointments. They're not compliant. We have to understand that like these people that live like in big family units, the family comes first. The family needs come first. So even though I have an appointment today, but if my daughter's birthday today, I'm going to attend the birthday. So it's the family that comes first. So when they don't show up for the appointments, they label them as non-compliant. Again, they're going to miss the appointments. Yeah. So these are the things that we need to, all these cultural nuances that we need to understand. So it's not because they're bad people. It's just that they have other priorities. Family, just like many Pacific Island cultures, is the family comes first.
And Phyllis, this perfectly leads into you as an interpreter, because I know with a lot of the hospital systems here, there is not only a need for people who can speak the language, but who understand the culture and can interpret the culture as well into that, whether it be treatment or services that are needed. What are some of the things that stand out to you also as far as misconceptions, stereotypes, and or things that are not being addressed within the culture that need to be interpreted and shared? And Filios, that's to you as an interpreter.
Oh, okay, I'm sorry about that.
No, that's all right.
I think one of the things that really need to be addressed is when people assuming that others speak English, because when they check in at the front desk, they answer a yes or no question and what's your name question. They were able to communicate that with them. So then when they check them, they automatically check it off on their chart that English is their primary language. I think that's one thing that many places have to understand, that they need to ask, what is your primary language? So that they know what language these people are speaking.
What else do you think can be done as far as, I saw you about to raise your hand there, Dr. Ali, so I'll get back to you in just a second. But what else do you think is not being either provided, despite your efforts, or included in either the interpretation or the types of services to make sure that they're being truly understood, not just through the words, but as far as the culture or other aspects of the family that needs to be included in that interpretation?
Yes, there are actually several factors that need to be included in interpreting service, and you know, in this language access. One is, I would like to see more trainings available for interpreters, and also for the state of Hawaii. Actually, I don't think there is any certification programs for any of the PIA languages. And with the judiciary tier in Hawaii, we do not have a language test for the Marshallese and the Chuukese languages. In fact, all the Micronesian languages that we have in Hawaii. So interpreters are not moving up tier. They're stuck in that entry level. So then many times interpreters have to branch out and find jobs because of that reason. It's either they don't have enough hours, or there is they go and work at a full-time job with benefits. One thing is, the state have a contract with the mainland company, and oftentimes when our departments call the agency that the state has the contract with, they are not answering their phone because they're probably sleeping, and it's after work hours. So then they would tell the other person on the other line, I'm sorry, there is no interpreter available. You have to call back later. And I see it as a very problematic system for our people. For example, the rental assistant, there were very limited spots available. And it opens for such a short time. And in that short time, people fill all the spots applying for rental assistance. And, you know, as an LEP, if they were to call and there was no interpreter available at that time, they're probably going to lose their spot. I want to say that there are a lot of good interpreters out there, and there are a lot of qualified interpreters in the state of Hawaii, and we have a number of agencies who are really, really good.
And we definitely want to talk a little bit more about your agency as well, because we have some questions that I want to get to that address precisely what you're doing when you started with No. So just hold on that for just a little bit. I wanted to get back to you, Dr. Alikin. I saw you were gonna, you raised your hand there and you had some comments.
Yes, thank you. So I was just going to add to what Phyllis was saying about the language access. You know, the doctor-patient relationship is very important. So language is the key. It has to be not just, you know, culturally competent, but very sensitive. You know, so so that needs to be a almost like a mandated part of the appointments. Because a lot of times you'll see these patients, okay, and they don't have that kind of access, and they go home with like understanding what's going on. So to me, like, that's that needs to be something that's taken seriously. And
It's 8
be a part
o'clock.
of the medical care.
Okay, now we all know it's 8 o'clock. Good, we got that. Check. Okay, good. All right, so let's get back a little bit to definitely one of the big areas, big challenges, which is what we touched on, which is the COFA, the Compact of Free Association. I'm not sure who would want to maybe just give us a little bit of a summary as to what exactly the COFA agreement is for people who don't understand what it's there for, because there's a lot of misconceptions to this day about this being just free money for people in Micronesia, and they're just taking advantage of it. That's not the case. It's a specific agreement, and for specific reasons, and there's a lot of deadlines coming up that could really impact this. So who wants to explain this to folks? Shanti maybe, or Dr. Alik?
Maybe I can attempt. So in 1986, I think 1986, when the Republic of the Marshall Islands entered into a treaty with the United States, and I think also same thing with the Federal States of Micronesia. And the year after that was the Republic of Palau, and that was the first compact from 1986 to 2003, I believe. And then there was a second compact from 2004 until I think it's going to end in 2024, and they're in the process of negotiations. And as I mentioned before, it's basically an agreement between these island nations, the United States, where the United States has the veto, strategic power over those islands, okay, as far as security and military installations, in exchange for the Micronesians to come to the United States without visa to live and to work. And one of the, if I may add, one of the, in 1996, there was a, one of the main issues that impacted the Micronesian community was the change in one of the benefits to the Micronesian. That was the 1996 Welfare Reform Law, which made these island people not eligible for Medicaid.
You said not eligible for Medicaid, is that correct?
Medicaid. So that took, I think that's it's been restored just recently, but it took about 25 years. And it was actually an administrative oversight where the status of the Micronesians were considered non-qualified, non-citizens. It was changed from a qualified to non-qualified non-citizens, made them ineligible for that benefit. So that really had a lot of hardship to try to assimilate to their new environment.
And one of the questions that came in, there's plenty of supportive questions that have come in as well, which I'll get to, but this kind of leads to some of the stereotypes, I think, that maybe if you can explain a little bit more. This comment from someone in Kaimaki saying, I see many young couples with children, unemployed, and not having a purpose. They are here to collect welfare, and our community suffers because of it. And maybe if you can explain a little bit more about what's happened with the monies from this COFA agreement, what it's supposed to go for, and why it's been far more challenging than people might think. Maybe Dr. Alik, if you could expand on that.
Yeah. So part of the agreement is to build the economy of these island nations, nation building. But one of the problems, I think, when the compact was negotiated, there was actually no assessment study to see what they really needs. Okay, that's one of the issues as I see, and then there was actually no technical assistance to make sure the money was used for the right purpose. So that's one of the issues.
So they weren't either getting the money or they weren't getting what they were supposed to be getting.
They were getting the money, but the money was based on there was no needs assessment as to how much money they need to build a nation. Okay, right. So they got the money, and then there was no technical assistance to help them build this economy. So there was money there. So the question wasn't enough. And number two, was it used the right way? So that's one issue. So that's the economy, and there's the health services, which is another issue. Now, if we were to take the people of Bikini, which were affected by the radiations, If you think about it, there was no, you would think there would have been some kind of a cancer center to take care of these folks. None was done.
This is severe, high levels of radiation they were exposed to.
All they had was a clinic. So you would think there was so there was like so as a result, a lot of these people came up here to get care. So that's the other issue that drove a lot of these people up to get medical care.
So it was difficult, or if not impossible, for them to get the kind of care they needed because they were so deeply medically wounded by what happened.
Exactly, and you also need these specialist care. You know, like oncology, all the diagnostic infrastructures that you would need, like a CT scans, MRI, that goes with building a medical center. None was built in the Marshall Islands up till today. Yeah, so that's the other issue that's impact a lot of these folks to seek medical care here in the United States.
And Shanti, I saw you raise your hand there, but just to expand that a little bit, I think there's another one of the stereotypes is that a lot of the health problems that maybe where people feel like they're seeing with some of these cultures and communities is genetic, but I don't know how much they understand the extent of how this radiation exposure has impacted generations of families.
Yeah, correct. So like so that's one aspect of that. The people weren't able to eat from the lands. Once you destroy the lands, people depend a lot on the fish, the lands. They couldn't cultivate anything. We're not even talking about the psychological impact. We're talking about PTSD. No one has been talking about that. These guys were traumatized. We're just talking about the physical part of this, about the psychological impact of the nuclear, and these are long-lasting impact on these people.
Shanti, go ahead. I saw you raise your hand.
Yeah, I wanted to just add on. I think a lot of people are asking, why are we giving them money, but they're still coming? One thing is that for a developing country, there are a lot of factors to build economy. And I'm going to start with one, tourism. We have beautiful islands. But do you know how much it costs for someone to go and visit the islands? The only airline that serves the Pacific, the Micronesian islands is United. And it's gonna cost one person for a round trip ticket, no hotels, no rentals, nothing. It's gonna cost one person about 1,200 to go and come back. So if we want to build a good sustainable tourism, it is not really appealing for tourists to go there because of the cost. And another thing is, if we want to create fisheries or other negotiate mechanisms to build the economy as far as trade or whatnot, part of that agreement is to get approval from the United States to enter into other regional agreements. So with trade, there are many challenges to cost. How much does it take for you to trade out? It is very expensive. So when we talk about technical assistance, there are a lot of root causes that really, when you take in a developing nation to build it, there are a lot of things that has to be structured at the beginning. So right now, I do not think that there is increase of employment in the islands. It's the same people that started working there. They're still there, most of them. So when we have kids that graduated and need jobs, there's really not enough jobs. So this is actually shared responsibility. But I can't speak to most of it, but I do know that there are challenges to building that economy. And those are some of the things that I mentioned earlier. And when we spoke about what did we bring into this treaty, national security. That is one thing that it's very difficult to put a dollar amount in. And one of my visits to Kona, there were a lot of Kosharians in that high school, and I know that building confidence and self-esteem is a challenge for this group of kids because there's just so many negativity that defines them. So I wanted to just give them a sense of why we are important to the United States, and what we bring to the table is national security. There is millions square miles of water that is under the control of the United States. And that is, to me, is of value. And so many people that came here, some of them don't have a choice. They need to put food on the table for many of their families. And that's not an opportunity that they get at home. So they come here. It's more difficult than ever when there is stereotyping and discrimination. Where you go and you look Micronesian, it's not an appealing and attractive choice, but people come knowing that because they need to provide for their families.
You know, you got to Bill and Kailua's question. He said, what is the greatest need for Micronesians moving to Hawaii? And you definitely talked about, you know, the relationship, just being in this area in the Pacific Ocean, that we all need to understand and recognize how this relationship is important to all of us. And I see you there, Dr. Alikin. I just wanted to mention a couple other comments because I'm getting a lot of questions coming in. Albert from Honolulu saying, locals get angry when Micronesians act out. He's saying he's smoking and drinking on the bus is what's something that popped in his mind, but he said we expect them to act a certain way, but don't help them to assimilate. And I think that goes to a lot of the points that a lot of you brought up about sort of not understanding the context of some of the challenges that might make it appear that way. But Susan here, a former nurse from the Marshall Islands, she said, I've lived in Hawaii for 52 years, was in the Peace Corps for 2 years in the Marshall Islands. They are the most beautiful, welcoming, warm people, and I don't understand why they're met with so much negativity. And again, I think it goes back to people understanding the layers of complexity and challenges that have happened, and how any human being might react to that. But Dr. Alik, I saw you raise your hand there.
Yeah, just to kind of add to what I said before, I think the compact negotiators, both sides understood that it was going to be hard to build this economy. Therefore, they made that clause where people can come here to the United States. To visa free and to find jobs and look for opportunities, and that's part of that. It's impact in the negotiation.
So let's get back. Let's talk a little bit more about the COFA agreement, because there are timelines on these agreements. Right now, the federal government assistance set to expire in 2023, so less than 2 years away for the Federated States of Micronesia and the Republic of the Marshall Islands. A separate agreement with the Republic of Palau expiring in 2024. How critical is it to renew these treaties? Is that maybe to you, Dr. Alik?
My understanding is the economic portions of the compact will expire, but not the security portion. So,
okay.
Speaking of security, a lot of the Indo-China Chinese and Taiwanese and all these, they're trying to make a play in the Pacific Ocean now. In fact, they're moving to, I think, Kiribati, China is moving there. So there's a lot of these other nations who are moving into this big zone. If you look in the old Micronesia, you can actually superimpose on the map of the United States, about 3 million square miles. There's a lot of buffer zone there between Micronesia and the Asian countries. So I think it's very critical. I've read news reports that the United States, they recognize that. I read recently that Congressman Case, I believe has a Blue Pacific plan or something, trying to recognize these islands and strengthen the relationship. So I think it's very critical for them to maintain their relationship.
What is your understanding at this point as to whether or not they're going to be extended? Maybe get everybody up to speed a little bit as to where the discussion stands, and what's the likelihood of these agreements being extended?
I'm not qualified to speak to that, but all I understand, there is actually ongoing discussion right now between the two nations.
I don't know, Shanti, I don't know if with the legalese that you deal with, if that's if you're a part of some of these discussions as well, as far as what needs to happen or what may be happening with these COFA agreements as the sunset dates start to close in.
Well, like Dr. Alik alluded to, there are continued discussions on those areas. And one thing that I know to be true and non negotiable is the immigration status. That is non negotiable. So the visa free entry is still there. What is negotiable is the economic portion of it.
And still being discussed. Mike from Kauai is asking about the treaty and wondering if they're only allowed to come to Hawaii or elsewhere. My understanding is within the entire United States.
That's correct.
That is correct. And, many people are asking why Hawaii? Well, if you're going to leave your home, that is one of the hardest things you're going to do. And where do you go to? Somewhere close to home, a Pacific neighbor. That's why many of us come here. But there has been increased movement out to the mainland because of all that's going on. And a lot of people are receiving very, very good support from the community because they are being included in what's going on in the community as a whole. Oregon, Washington, all the states are welcoming the citizens and allowing them to be a part of their community. So many people ask why here? This is where many of us feel close to home. But then it may change because at the cost of getting all those comments, it's now different from when many people came to where they're now destined to go, because word of mouth travels fast and a lot of people are not wanting to go through that life.
I want to get to you, Philios, and the work that you're doing and give you a little bit of time to talk about your program, because I have several questions here from people asking about programs to help people transition to a new culture. Mike from Makiki talking about programs prior to coming to America to prepare them for what to expect. And then also Ms. Uitingo asking about education for children and their parents for better acclimation and understanding in the school system. What do you want to share about what kind of help is needed and what you're doing with your program, which you said really started quite recently? Tell everybody about No.
Yes. I actually like that last question where someone asked about programs that need to be implemented for the kids and the parents. I think that's what needs to be done. We need more Micronesian representatives in the government and in places that are reaching out to Micronesian, like the schools, with state different agencies or departments. I think the problem will be addressed if we have Micronesian representative in these places. For example, Shanti, who is a Micronesian liaison with the city and county. We saw recently that more and more services are available to Micronesian, and the department is reaching out to the Micronesian community. They know who to talk to get the help out there. With the rental assistance, they were able to figure out how to get it to the people who speak a different language. And that is by hiring other agencies that have Micronesian workers who speak the different languages that we have. So kudos to the city and county.
Yeah,
and
that goes
Shanti,
to, sorry to interrupt, goes to Linda's comment about greater involvement of community health workers as well, social workers, and more advocates to help combat the negativity. But tell everybody precisely, what is No, and what do you do, and how does it help?
Yes, so No is a very new organization. We started in April. And actually, April is when we officially started. But before April, we were a pro bono organization that just volunteer our times after our working hours and in our free times. In March of 2019, 2020, I first had the call to help with an unemployment application. Um, After that phone call, we started to realize that there were more Micronesians who needed help or were having issues with applying for their unemployment and for rental assistance. So from then, it was a number of us that volunteer our time to help our friends, relatives, and people in the community, enrolling them on these assistance. So one of my good friend, Uni, posted on Facebook that she wanted to get back into community work, and she's free to help whoever needs help with this kind of services. So then I reached out to her and we talked, and she had the passion to start Nono as a Micronesian organization to help Micronesian. The organization is motto is Micronesian, empowering Micronesian. And from then on, we started helping people, and we feel that the organization must continue what it's doing. So we agreed to file our license in April. And our hope for Nono is to be the mother to many Micronesians, to help them transition and navigate successfully in the Western world.
And no doubt this help is needed, and an expansion of that. We only have a few minutes left, but there's a few more questions I wanted to get to. And Dr. Alikin, you had talked to, I just wanted to make sure people understood from a healthcare perspective, you touched on some of the health issues, and you provide medical care to Marshallese residents who are exposed to radiation following the nuclear testing. That was decades ago, as far as the nuclear testing. What can you explain to people as far as what you're still seeing to this day from the impacts of that?
So I was on a team that provided care to the folks who are exposed to the radiation fallout. These are mostly people on Rongelap Island that were downwind from Bikini. They were part of the Bravo testing. And a lot of these people have solid cancers, some thyroid cancers. We're seeing like stomach cancers, even as young as teens. We're seeing liver cancer, women having miscarriages. So there are lots of cancer in this particular population that's were exposed to this fallout. So a lot of these folks are here, okay, seeking care, okay. The testing was done actually in 1954. Most of them are kind of pretty old now. The United States still trying to provide care, but that population is almost extinguished. But they're even seeing residual cancers in other places, that were not considered exposed to the downwind fallout. So there's belief that the whole Marshall Islands is exposed to the radiations. Now, this is also a political issue of contention, because the Marshall Islands ones, this is what happened. The United States refused to believe that. And so there is back and forth with this issue. And I remember Shanti was saying initially when in 2010, when this whole negative and narrative against Micronesians started growing, and that's when the states actually was trying to purge Micronesians off the MedQuest at the time and put them in this really bare minimum healthcare plan that would not even cover dialysis, cancer treatments. So that was an example of that's a malice, and it's not part of this treaty we're talking about. Then we have the 1996, where the Medicaid eligibility that happened to these folks. So there are things that happen, like systemic issues that actually didn't live up to that part of that the compact.
And no doubt that's still ongoing. We only have about a minute left. I know we just blow through this time so quickly sometimes. But Shanti, I did want to end with you to talk a little bit more about moving forward and what people need to understand about whether it's the COFA agreements that need to be and the support that needs to continue to grow. I mean, I would imagine the population of Micronesians is growing. So what else do you want to close with and share with people about what we need to think about moving forward? We've got about 30 seconds.
You were referring to programs earlier. I just want to, besides this awesome program that Filios and them started, there's Marshallese organization, Community of Hawaii. They started a partnership with the schools this summer to provide cultural enrichment. And that's not only within the Micronesian student population, but the overall student population. There are talks about providing orientation and exit for families that are leaving on what they need to know before they come to the United States. And these are pending approval and execution from Congress funding. And those talks are trying to be raised by PREL.
And I know there's more to talk about. I'm so glad you're all here so people can see you and identify some of the help that's out there. So mahalo to all of you for joining us tonight. We thank our guests, Shanti Sigra Asher, City and County of Honolulu Pacific Islander Liaison Officer, Chuukese language interpreter Filios Urman, and family physician Dr. Wilfred Alik. Thank you again so much. All right, Insights. Next week on Insights, they are the top elected officials in their respective counties. We'll be speaking with Hawaii's 4 mayors to find out the biggest issues facing each of them. Please join us then. I'm Laurie Amata for Insights on PBS Hawaii. Ahui ho.